Each year, 1.9 million people die worldwide due to uncontrolled bleeding, which has made blood loss the leading cause of preventable death from injury. The Tidewater EMS Council's Whole Blood Initiative is trying to change that outcome for patients in our region.
Rarely in the arena of trauma have we ever been able to impact a patient outcome as we can with the use of whole blood.
Studies have shown that this improves outcomes for our trauma patients, improves their mortality rates, and also improves the morbidity rates associated with this. And the earlier we can initiate this, the better.
We're bringing the TIMS region to the cutting edge of medicine in the pre-hospital realm.
This is a game changer when it comes to EMS.
Dr. Joseph Katora, the medical director of Navy Medical Atlantic, says putting blood in the ambulance and taking it to the scene will help decrease the risk of death or severe complications associated with traumatic bleeding.
And the idea here is that the patient gets access to whole blood faster rather than waiting for the packaging and transport to the hospital.
Sometimes in the field we can't necessarily always stop the bleeding, but being able to replace those blood products to ensure that our organs are getting the nutrients and oxygenation that they need is very important.
Dr. Michael Mardiak, an assistant professor in the Department of Surgery at Eastern Virginia Medical School, is also a critical care surgery specialist in Norfolk who treats trauma patients.
We found that if we can give whole blood to patients who are bleeding, they have a better outcome.
That's why the Tidewater EMS Council is excited to bring this program to the region. TIMS estimates that there is a need for 240 units of blood annually to be administered to trauma patients in the field. That will translate into dozens of lives saved.
We know from research that the leading cause of death in people aged 46 and under is trauma. We have an opportunity to increase survivability of our trauma patients in region.
We think that it's going to help to even have those patients that may not have been able to make it to us in time, make it to us, that we can actually intervene and save their lives.
To receive a treatment that has the ability to control blood loss and allow them to be operated on by skillful surgeons that then come off the operating table, recover in a room in the hospital, and eventually be discharged home.
This is truly a leap forward for EMS. Just the idea that the system is willing to do this and to offer this to the citizens is outstanding and truly inspiring from the pre-hospital side and from an emergency medicine side.
While it's proven whole blood administered in the field saves lives, the ability to expand it throughout the region quickly is unfortunately being hindered by the cost of the program.
So we're doing essentially a phased implementation where we're starting, in Virginia Beach, and then we intend to spread across jurisdictions like the city of Norfolk, the city of Chesapeake, Portsmouth, and Suffolk. But we can't get there all at once just due to the sizable cost to roll this out. So the sooner that we can raise the money to expand the program, the wider spread that it will be in region.
I think that this is going to be something that's going to be a great tool to have in the toolbox of our pre-hospital providers to provide care and allow them to affect the outcomes of the patients in the long term.
To help collect the whole blood that's needed for this initiative, TIMS is working with The Blood Connection to hold quarterly blood drives and encourage anyone who can to donate.
We will do 4 blood drives a year, 1 each quarter, with a goal of collecting 250 units each quarter. We may be also providing blood into other places, but we do focus on trying to return as much of the blood collected here to people that in need here.
I think this whole blood initiative is going to be something that we're going to look back and say, like, we've saved lives with this initiative.
It's the region-wide implementation that we're going to realize the full impact that whole blood in the field can have in saving lives.
To find out how you can help with the TIMS Whole Blood Initiative, go to donate.tidewaterems.org.